Bonjour tout le monde. Good morning, folks. My name is Maxime Lé, and I will be your moderator for today. Je m'appelle Maxime Lé et je serai votre modérateur aujourd'hui. Merci d'être parmi nous pour ce point de presse. Thank you for joining us for today's media availability. In case this is your first time joining us, to view who is speaking on Zoom, please put your view on Speaker View instead of Gallery View. The button for this is located on the top right corner of the Zoom video screen. Si c'est la première fois que vous vous joignez à nous, veuillez changer votre écran au mode Speaker, en anglais, pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin the interpreters, Christopher and Annie, or follow along on YouTube. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes Christopher et Annie ou suivre la diffusion YouTube. Today, we will be hearing remarks from Mayor Jim Watson, from the chair of the Board of Ottawa Board of Health, Councillor Keith Egli, and Medical Officer of Health at Ottawa Public Health, Dr. Vera Etches. Aujourd'hui, nous allons avoir la participation du maire Jim Watson, de la présidence du Conseil de santé d'Ottawa, le conseiller Keith Egli, et de la médecin-chef en santé publique à Santé publique Ottawa, Dr. Vera Etches. I will now hand it over to Mayor Watson for opening remarks. Mayor Watson, c'est à vous.
Merci beaucoup, Max. Thank you very much, Max. And good afternoon, everyone. Bon après-midi, mesdames et messieurs. And I want to thank everyone for taking time out of your schedule to join us at this media availability. The public health situation in Ottawa is evolving quickly with the emergence of the new Omicron variant. Les indicateurs actuels montrent une augmentation constante et significative du nombre de personnes qui testent positives pour le COVID-19 au cours de la dernière semaine. Today, I want to walk you through some of the steps the city and Ottawa Public Health have taken in the last few days to combat the rapid growth of the new variant. On Monday, the city's Emergency Operations Center, the EOC, moved from enhanced operations to activated operations to tackle the rapidly spreading Omicron variant of COVID-19. Public health workers have been reassigned to help with immunization efforts, and the EOC was reactivated to assess resourcing needs and to support an increase in booster vaccinations. We're working hand in hand and around the clock to get capacity increased at our vaccination centers. The current rise in cases, coupled with the increased demand for vaccinations, has severely stretched our staff and community health partners. I ask for your patience and understanding over the next few days while we ramp up our capacity. We'll continue to update residents as more appointments become available. And I want to emphasize that anyone who is eligible for a vaccine, whether it's their first, second, or third, will be able to get a vaccine. Je recommande que toute personne éligible à une troisième dose prenne un rendez-vous desquels seront disponibles. On Monday morning, I'll be going to get my booster shot registered online with the provincial portal. I want to thank residents for being caring citizens and neighbors, for getting vaccinated, and for doing your part for the greater good of our entire community. In particular, I want to thank some of our youngest residents who have gone out to get the vaccination with their parents. Just yesterday, OPH reported that over 51% of kids 5 to 11 in Ottawa have already received their first dose. That's something we should be celebrating and thanking these young people for. Ottawa residents have been leaders at all ages in Canada in getting vaccinated, and I have no doubt we can continue to do it again with Ottawa residents stepping up to get their booster shots. For those looking to book a vaccine appointment, visit ontario.ca/bookvaccine. That's ontario.ca/bookvaccine, or by calling 1-833-943-3900. That number toll-free is 1-833-943-3900. Le numéro est 1-833-943-3900. Or you can check with your local pharmacy to see if they're offering doses. With expected gatherings during the holiday season, we must continue to follow the instructions and guidelines from Ottawa Public Health and do everything possible to slow the spread and protect our community. I want to stress the importance of getting vaccinated, wearing a mask, limiting contacts, and maintaining physical distance from others. If you're not feeling well, stay home and get tested right away. I also want to repeat what Federal Minister Jean-Yves Duclos said yesterday, quote, "To those who are planning to travel, I say very clearly, now is not the time," end quote. Nous avons tout un rôle à jouer pour ralentir la propagation de COVID-19 et de se protéger. Cela commence par l'obtention de votre dose de rappel. I know that this can be upsetting and difficult to hear. I want to remind residents there are people here and resources available to help you during this difficult time. The distress line, helpline services are available 24/7 to provide crisis management and intervention, emotional support, and other services. You can contact the distress line at 613-238-3311. Le numéro est 613-238-3311. Please continue to look out for others in the community, and please get your vaccines. Thank you very much. Back to Max. Or to Keith.
Thank you,
Okay,
Mr.
thank
Mayor. Hello, bonjour, Quay. Thank you for joining us this afternoon for an update on the COVID-19 situation in Ottawa and Ottawa Public Health's pandemic response. And thank you for helping us to share the most up-to-date information with the city's residents. It's been 1 year since we started vaccinating against COVID-19. And as you have no doubt heard by now, we are still working hard and going strong. And while it may be difficult to fathom right now with everything going on, our vaccination progress to date has been nothing short of monumental. We know that it has been a struggle to find available appointments for boosters in Ottawa. You will shortly hear from Dr. Etches about what the team at OPH are doing to help increase access for Ottawa residents. But we know what to do in the meantime. As the mayor indicated, limit your close contacts, wear a mask, practice proper hand hygiene. This is how we can help to control this. It's how we've controlled it for the last year or so. This is how we reduce transmission of COVID-19. It works hand in hand with getting your booster or getting your vaccination. Once eligible, it is incredibly important for you and your loved ones to get that booster. I got mine earlier this week at a local pharmacy, and I'm encouraging my family and friends to get theirs as soon as possible. There are numerous ways to get vaccinated in Ottawa. There are community clinics, some family doctors are participating, and there are pharmacies. I know this is hard to hear, but let's do what we can now for a happy and healthy new year. I'm now going to turn it over to Dr. Etches for the update.
So thank you. Hello, bonjour, and Quay. Ottawa, this is a bittersweet day. There's a lot here for us to unpack as things have been changing quickly. And it's bittersweet because, as the chair mentioned, we did just pass the 1-year anniversary of the first vaccine given in Ottawa. And we've accomplished a colossal feat since then. People have worked so hard to book those appointments, to come out and be vaccinated, to offer those appointments. And it deserves to be recognized. I'm incredibly proud of what you have accomplished. Vaccination has saved lives. We saw that dramatic difference in the long-term care homes. It's prevented hospitalizations, and it's continuing to do so. La vaccination a sauvé des vies et a prévenu l'hospitalisation et continue de le faire. At the same time, we're facing a new obstacle, Omicron, the Omicron variant. And at this point, the science table confirmed this morning. It is safe to assume that this more transmissible variant is quickly becoming the dominant strain in Ottawa. And while we await more data about the virulence of this variant, we know it will put a significant strain on our healthcare system. Data shows the Omicron variant is significantly more transmissible than other variants, including Delta, and it's putting unvaccinated populations and partially vaccinated populations at risk. So the rapid difference that Omicron is making, even from last week to this week, it's being felt and reflected in our case management. As announced earlier this week, our case management team is over capacity, meaning that people who test positive for COVID-19 may experience delays in hearing from Ottawa Public Health. And so we're asking individuals who test positive to notify their high-risk contacts and advise them that they've been exposed to COVID-19, and that if you're a high-risk contact of someone who's tested positive, to please isolate immediately and then seek testing regardless of your vaccination status. But that's a change due to the Omicron variant. En raison des délais En raison des délais d'obtention des résultats de tests de dépistage de la COVID-19, nous demandons aux individus qui reçoivent un résultat positif de l'annoncer à leurs propres contacts à haut risque et de les avertir qu'ils ont potentiellement été exposés à la COVID-19. Et si vous êtes en contact à haut risque de quelqu'un qui a testé positif pour la COVID-19, s'il vous plaît, isolez-vous immédiatement et allez vous faire passer un test de dépistage, peu importe votre statut vaccinal. Ça, c'est différent avec le Omicron. And updated information regarding testing and isolation can be found on our website. Again, as the situation changes, we'll continue to modify our approach to testing. And after consulting with provincial partners and fellow public health leaders, we have made the decision, as the mayor mentioned, as a city to reactivate the City of Ottawa Emergency Operations Center. What this means locally is currently being discussed, but we know what it means is that we're working together to grow our capacity to deliver solutions for vaccination, and we're not going to stop. And with yesterday's announcement from the province on expanding eligibility for a third dose of the COVID vaccine to all adults 18 and over, and now a shorter dose interval for that third dose, we will continue to ramp up efforts to be able to vaccinate as many people as possible, as quickly as possible. For Ottawa, this means 750,000 people. 3/4 of our population will be eligible for a third dose as of Monday. And this is a massive undertaking, and we've done it before, and we will do it again. I know there has been frustration currently among those who are eligible when it comes to booking appointments. I want to assure you we are doing everything we can. We know the province is speaking to pharmacies to do everything they can, and we're continuing to explore options to keep opening more appointments, keep increasing capacity, and vaccinate everyone eligible as soon as possible. So this means we're working with our hospital partners again. They're pulling in additional clinical staff to provide vaccinations. We're temporarily reducing our public health programs, everything almost, including our mental health and substance use health work, our home visits for new parents. It's not ideal, but that is how critical this work is right now. So over the last week, we have managed to double our vaccination capacity compared to the previous week, and we're continuing to work with partners. I'm happy to announce we've added an additional vaccine site at the EY Center to accommodate up to another 2,700 people per day. Je suis heureuse d'annoncer que nous avons ajouté une autre clinique de vaccination au EY Center qui pourra vacciner 2,700 personnes par jour afin de doubler notre capacité. So this afternoon, Ottawa Public Health has released 10,600 more appointments at the EY Center and the Nepean Curling Sports Pucks, that curling rink, with appointments that will begin on Saturday. So I know it may take some time for you to get your booster dose. So you can continue to follow Ottawa Public Health social media accounts for the latest and when we increase capacity and availability for appointments. We have more information on our website about how to book the doses and the different options. So I want to remind residents that we still have a lot of control when it comes to doing our part to reduce the risk of transmission of COVID-19. Je veux rappeler aux résidents que nous avons quand même beaucoup de contrôle concernant pouvoir faire notre part dans la réduction du risque de transmission de la COVID-19. These are things we've all become too used to over the last 2 years. I do look forward to the day when it's no longer part of my updates. But for now, we must continue with limiting our close contacts, wearing masks, maintaining physical distancing, and washing our hands regularly. Stay home when sick, except to get tested. Pour l'instant, nous devons continuer à limiter nos contacts étroits, de porter des masques, de maintenir la distanciation physique et laver régulièrement nos mains. Et restez à la maison quand vous êtes malade, sauf pour aller vous faire passer un test de dépistage. Measures to limit close contacts through capacity limits are also going to be needed. We understand that the province is actively considering what to implement. The Science Table and the Council of Medical Officers of Health have made it clear this week that action is needed as soon as possible. With respect to testing, many parents have come to us asking for a bit of clarity on how to use the rapid antigen tests in schools and over the holidays. So the current use of rapid antigen tests in schools is a program that stood up whenever there's an outbreak that occurs as an added layer of screening. It's especially considering that not everyone is fully vaccinated yet in school settings like elementary schools. Vaccinating children 5 to 11 will make a difference. It's just that they have only one dose, and we still are just over half of this population protected with the first dose. So there is also a rapid antigen testing program being rolled out and overseen by the Ministry of Education during the holidays. This is in direct partnership with school boards. It doesn't involve Ottawa Public Health. These tests are intended to be used multiple times over the school holidays to screen for COVID-19. And some businesses are also making use of the supply available through the Ottawa Board of Trade. So if your rapid antigen test is positive, the advice is the same: to seek confirmatory PCR testing at an assessment center right away. And the testing approaches, again, we're going to continue to review how they're being used. As always, it is critical to remain isolated until you receive a negative COVID-19 test through the province of Ontario's results portal or the relevant hospital results portal. Some are expressing it's taking a little bit longer to get results back, and so please do wait to confirm that you have that negative before leaving isolation. Comme toujours, il est primordial de demeurer isolé jusqu'à ce que vous recevez un résultat négatif au test de dépistage de la COVID-19 par le biais du portail de résultats de la province de l'Ontario ou de celui de l'hôpital approprié. Pandemic has been long, and it will go on a little while longer. But please, just as much as I want you to get a COVID-19 vaccine, I also want you to be kind to yourself, to check in with friends and family, to take care of your mental health. S'il vous plaît, je veux vous rappeler que même si je veux que vous allez vous faire vacciner, je veux tout autant que vous soyez gentil avec vous-même. Parlez avec vos amis et votre famille, et prenez soin de votre santé mentale. And please visit Ottawa Public Health/mental health for a list of resources that could be available for you or someone you care about. Now is not the time to give up. We are in a better position than in March of 2020, when we faced a surge of COVID-19 in an unimmunized population without knowledge of all the measures that can limit COVID-19 transmission. Vaccination's building, and it will keep putting us in a better place to face our future challenges. We can look forward to everyone having restored vaccine effectiveness against the Omicron variant with 3rd doses and children with 2 doses in the very near future. It's just not fast enough to enable us to gather as usual over the holidays. So your actions make a difference. Vos actions font une différence. And we will battle our way through this surge together. Thank you, merci, and miigwech.
Thank you, Dr. Etches. Merci beaucoup. Just before we move on to questions, I would like to note that we are also joined by Kim Ayotte, the General Manager of Emergency and Protective Services, who is available to answer questions as well. Nous avons aussi avec nous aujourd'hui le Directeur général des services de protection et d'urgence pour Ottawa, qui sera disponible pour répondre aux questions des médias. I will now invite each media agency in alphabetical order to ask their questions. Please remember that you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique et chacun pourra poser une question ainsi qu'une question de suivi. We will start with CBC Ottawa, Nicole Williams. Nicole, over to you.
Thanks. My question is for Dr. Etches. I think a lot of people were expecting to hear the city announce its own measures, just given the province really didn't put anything in place yesterday. I know people were surprised then too. I'm wondering why Ottawa is choosing not to issue a Section 22 order and really, put in some further restrictions that I think so many people know would actually help curb the spread of Omicron.
I appreciate your assessment that vaccination alone will not help us with the surge to come very soon. So this is an active conversation. The way we would likely address the need to reduce our contacts, besides what we can each do, is to think about capacity limits in different settings. And so this is the kind of conversation that we're having with the Office of the Chief Medical Officer of Health. My understanding is there are still discussions happening provincially about what may be done this week. And we are also talking about what may be done at the local level.
Okay, and my next question is actually for Mayor Jim Watson, a bit of a different topic, but we know that the city filed an application in court yesterday over RTG failing to live up to its contract after the 2 derailments earlier this year. I'm wondering if this is a sign that things are getting worse and the city might consider breaking the contract.
Well, the service is getting better. Because we've seen 6 or 7 weeks of very good service. I think we issued a memo yesterday. We're at about 99% on-time train service. With respect to the court action, that is simply put forward to show that council is very serious about our partner living up to its obligations to deliver the service that we expect. And we had to take that action, obviously, because our legal advisors told us this was the next logical step in terms of ensuring that the consortium, RTG and RTM, understand that they still have not met the expectations we and the taxpayers have for LRT. So while the service is improving, we're hoping that this will act as a catalyst to ensure that our partners understand we're very serious about seeing the quality and reliability of the system improved dramatically, as we've seen in the last 6 weeks. Thank you.
Okay, thank you very much, Mayor Watson and Dr. Etches. Just a reminder, folks, to please keep questions related to COVID-19 for this availability. Next up, we will move on to Chin Radio with Jerry Absey. Jerry, over to you.
Good morning, and this question is for Dr. Etches. Dr. Etches, earlier this week, you had mentioned 280,000 eligible people in Ottawa have not taken advantage of the booster shot. Have you seen a change in those numbers now that the variant has become front-line news?
What we know is that actually, and thank you to people in Ottawa, the demand is high. So the 283, it's not necessarily that people didn't want their booster yet. It's just that it was taking time. People were making appointments, maybe slower than they were for their first and second doses. But now we see the demand is there. So as we put up more appointments into the system, they are booked within hours. So I don't think we have a challenge right now with demand. I think we have a challenge with supply, which is what we are 100% focused on, very much treating it as an emergency response to increase the capacity to vaccinate people. And I think the additional challenge being that number is no longer 283, it's now 750 that will be eligible, 750,000, to be clear, that will be eligible on Monday. So we are going to make sure we get to all those people again.
Thank you.
Okay, do you have a follow-up?
Yes, now you said bookings for the vaccines. Is that done on the basis of available vaccines, or you're anticipating on the arrival of some vaccines?
We're fortunate in Canada to have a good supply of vaccine for COVID-19 and in Ontario. So there's no challenge with the supply of vaccine for the Ottawa clinics. The challenge is the number of immunizers. And this is why there have been calls out to hospitals, to paramedics, to primary care providers, to nurses, to students. We're really looking to help get help from all different quarters. And the emergency operations team, Ottawa Public Health, are really focused on actually finding new contributors to the Ottawa vaccination effort, because we want to go higher than we ever have per day in terms of offering the vaccine appointments. So we're going to continue to add appointments into the provincial system as we have the immunizers and the capacity to deliver.
Thank you, Dr. Etches.
Thank you, Dr. Etches. Thank you, Jerry. Next up is Alex Gouge with City News Ottawa. Alex, over to you.
Hello, I just have one quick question today. So we've been hearing a lot that it's difficult to book a test without being a few days out. So what's being done to ensure there is sufficient capacity for testing?
It's Omicron that's changing the game here. It's having us relook at all things we're doing to handle COVID in the community. So we're actually thinking about how we offer testing at the assessment centers. We know the demand is high. It's grown really a lot over the last number of weeks, and even more most recently. And so, there are different approaches that may be more do-it-yourself kinds of approaches, like we've done with schools, to have take-home kits in the schools. And we're trying to find the right balance here with a limited number of nurses and staff that can provide clinical care. We're thinking about how do we maximize immunization and still provide access to testing, perhaps in new ways. So this is all actively under conversation. In the meantime, the hospitals that run the testing centers have been adding capacity. They have grown capacity to increase the service as the demand has grown, but we will reach a limit. This is the reality. Our labs also, you heard me mention, sometimes they're taking a little longer to get results back. There's a limit to how much volume they can handle. So we'll have to keep reviewing the priorities for our testing system as Omicron keeps adding pressure.
Thank you. Follow up? Okay. We will now move on to CTV Ottawa with Josh Pringle. Josh, over to you.
Good afternoon. My questions are for Dr. Etches today. You referenced in your opening statement about the modeling today. It showed that Ontario needs an immediate circuit breaker to blunt the spread of the virus. Would you support a circuit breaker type restriction right now to stop the spread of COVID-19 in Ottawa and across Ontario?
I definitely see the assessment that the situation is serious, that if it carries on as is, we won't be able to handle the pressures on the hospital. So I agree that there are things we can do to change this course. Some of them involve our own actions and limiting the number of people we're in close contact with. And we need, to also look at how do we support people to limit their contacts, and that would be by, thinking of capacity limits in more settings. So, I am in support of that. Those are the kinds of conversations that we're having about how to advance this, where we know this is a question across the province.
And my follow-up question, Christmas is a week away. People are planning to either get out of town or welcome visitors starting this weekend. What's your advice to people who may be planning to gather with family and friends for Christmas over the next week, and what sort of gathering should they look at?
I think that the smaller the gathering, the better. So to prioritize the people that you want to meet with and limit other contacts. We know that vaccination does make a difference for the severity of illness, but it no longer is, the case that it was someone with 2 doses is, less likely to come into contact with Omicron or that. So what I'm saying is, when you're considering vaccination status now, we also need to think about, does somebody have their booster dose, especially if they're an older adult, more vulnerable to severe infection. But vaccination status isn't the only protection. You can add in other things that decrease COVID transmission. So opening the windows, increasing ventilation, making sure well-fitting masks are used. All of these things are different layers of protection that can help reduce the risk. So my recommendation is have some difficult discussions. Think about what's most important to you. These are really hard decisions. There are conversations happening in my household right now too. It's a challenge because we were all looking forward to the holidays and being able to meet with people. I think the bottom line message is the fewer contacts we have, the better at this time. That is important.
Thank you very much.
Thank you,
Dr. Etches. Thank you, Josh. Next up is Craig Lord at Global News. Craig, over to you.
Thank you. Dr. Etches, a bit of a follow-up on Josh's question about holiday gatherings, and there's been a lot of talk about rapid tests as another screening mechanism. I think a lot of people are hoping to take tests in advance of these gatherings. I was just hoping maybe you can speak to that strategy and how effective it is and what the limits are of rapid testing in keeping gatherings safe over the holidays.
Thank you. So it is true, rapid tests are becoming more available and there's high interest in using them to assess whether someone has COVID before their gathering. Our understanding of their ability to detect infection that is contagious, like when someone has COVID and they're in the time of being able to pass it on, is that has been demonstrated to be more useful than we previously thought, especially when there's high levels of COVID in the community. So I'm supportive of people using rapid antigen tests, but there are limits. So it's really not a guarantee if you have a negative test that for sure there's no COVID, because sometimes it is a bit early to pick it up. We know that if you have a positive, we want to make sure it is truly a positive by having a confirmatory PCR test. So if it turns positive, it would mean to isolate, to not participate in the gathering and seek that confirmation. What else about a rapid test? I think the places where we're using them, the programs that Ottawa Public Health is running for schools, it's most useful if people use them regularly. So repeatedly over time, we're more likely to detect COVID earlier. And so that's the idea with, I think, the Ministry of Education giving a number of tests to children, is to use them through the holidays, not just at one point in time.
Thank you. And one of the things that you mentioned in your comments is this message of don't give up. We're in a better place. But this is now the second holidays we've gone into under COVID restrictions of some kind. Are you worried that there's a fatigue out there and that people won't be as receptive to public health messaging for the second holiday season in a row?
I absolutely feel the fatigue. I think there is a lot of fatigue out there. That is a reality we are all facing. It does make it harder. It makes it harder to rally. But I also know that we can do this. Like we have done it before. And that support for each other to take the next step. It's true, when the appointments are there, do that. It will make a difference. We are in a better place. If you think back last holidays in December a year ago, we didn't have the protection of 2 doses in long-term care homes. Like things were worse in that way. And the reason why it feels similar is because Omicron is different in terms of how quickly it grows. And so that's the challenge, is that we've come now to a new variant that's just a bit harder to slow down in terms of its growth. But we have that underlying protection, which will help us. So I think it's important for people to realize that what they did has helped. It's kept death and hospitalization lower, and it's enabled children to be in school. These are things we want to keep in place. And it's why we do need to take these actions now to limit our contacts now, because it will help us continue into the new year with more of the things that we need. Even though it's tough, these holidays are not quite as we had hoped.
Thank you.
Thank you very much. Nous allons maintenant procéder avec le droit. Julien Paquette. Julien, c'est à vous.
Oui, bonjour. Peut-être juste nous donner peut-être une idée de ce qui nous permet de savoir que le variant Omicron est sur le point de devenir la souche principale dans toute la transmission qui se fait à travers la ville et la province. Par exemple, aujourd'hui, on nous dit qu'on est maintenant à 13 cas confirmés de ce variant-là. Peut-être nous expliquer un peu, dans le fond, comment on arrive à ces conclusions-là.
Oui, c'est clair que ça prend temps d'avoir un résultat confirmé par le séquençage des variants. Ça prend 10 ou 14 journées d'avoir les résultats. Et pendant cette période, il y a déjà plus de transmission. Le variant Omicron, c'est plus hautement transmissible. C'est le cas que le taux double dans quelques jours. Alors, on n'a pas le résultat, la confirmation immédiatement. Alors, ce n'est pas là dans notre chiffre. Mais quand le laboratoire de santé publique Ontario fait leur étude, il y a une première étape, un dépistage préliminaire qui démontre que c'est probablement Omicron dans la majorité. Et parce que c'est plus hautement transmissible, c'est le nombre de cas qui a grandi, c'est probablement Omicron, pas le Delta. OK.
Et peut-être aussi nous rappeler un peu, vous en avez donné un aperçu la semaine dernière lors de la dernière conférence de presse, mais un aperçu de ce que les gens devraient, la façon dont les gens devraient s'adapter durant la période des fêtes, avec les rassemblements qui sont probablement prévus depuis un bon moment, qui sont attendus depuis quelque temps, avec les 2 dernières périodes des fêtes qui n'ont pas été possibles comme prévu. Donc, qu'est-ce que vous recommandez aux gens finalement de faire à la lumière des récents développements?
Je recommande de limiter les contacts étroits, de choisir avec caution le nombre de personnes à l'intérieur où on ne porte pas les masques. C'est clair, la situation est pire que la semaine passée. Nous avons plus de données cette semaine. Alors, à mon avis, ça continue d'être que c'est pas possible d'avoir des grands rendez-vous à l'intérieur sans les masques. Et de penser à le statut vaccinal des gens. Maintenant, c'est une 3e dose de vaccin qui augmente la protection. Pour les personnes plus aînées, c'est tellement important d'avoir cette 3e dose. Et on peut utiliser les autres mesures comme la ventilation, la distanciation, de réduire le risque. Mais peut-être aussi, c'est une bonne approche de prioriser les fêtes, les rendez-vous et diminuer les autres activités qui donnent un risque. Comme j'ai mentionné auparavant, des activités sportives où il y a contact étroit sans les masques. C'est important d'arrêter avec les contacts comme ça et ça peut aussi diminuer le risque pour les fêtes.
Juste une petite précision, est-ce qu'il y a une recommandation pour la taille des rassemblements en tant que tel, le nombre de personnes?
Je sais que beaucoup de gens parlent et discutent 10 personnes à l'intérieur et 25 à l'extérieur. C'est meilleur si c'est le plus petit que possible. Alors, il n'y a pas exactement un chiffre. Chaque famille est différente.
Merci.
Merci. Next up, we go to the Ottawa Citizen with Elizabeth Payne. Elizabeth, over to you.
Thank you. Thanks for taking questions. And this is for Dr. Etches. Excuse me if I'm asking you to repeat something, but you, I know, also heard some pretty dire warnings coming from the Science Advisory Table this morning. And the advice was needed a circuit breaker now, even yesterday should have been according to their modeling. Why are we just listening to advice? I mean, we've heard people saying we've done this before, but it's never been done before without capacity limits. And people can now gather in bars and restaurants at full capacity. Are you counting on the province doing something? At what point locally would you take restrictions, or do you feel that that's too hard for local PHUs to do right now?
I have seen and taken to heart that the vaccination is not enough to help improve the situation and make it through this surge. I agree, we need to decrease capacity. And so it's a conversation with the province about the best tools. And these are active conversations. So I am absolutely prepared to write a letter of instruction under the Reopening Ontario Act to take a look at how we can protect each other with capacity limits. And we know these are things we can do ourselves as well. Right now, we can limit the number of close contacts that we have. So I think all of these things are needed.
Okay, and I just wanted double check. I do have a second question, but when you say I can write a letter under the act, that's the section 20, that's local. Is that
local,
what that means?
Local action of the medical officer of health. It's different from a section 22, but this it's a letter of instructions, the formal term under the Reopening Ontario Act, but it is taken by a medical officer of health. So that's what I'm looking at.
Okay, thank you. And my second question is, among other things, they were talking about ICUs being at unsustainable levels, perhaps by the end of January. What do you know about the situation of our local hospitals, and is there support? Can there be support if things start to go that way?
Thank you. I think this is a really important point to pause on because it has not been clear before today seeing the science table data. It hasn't been clear that Omicron could affect our intensive care units like that because people have been talking about a high number of cases. The cases are growing. We haven't seen the hospitalizations grow in Ottawa still yet. And I think what the science table was underlining is the numbers will get so high that even a small proportion of serious illness will cause significant pressure on the ICUs. That's serious. And so for us in Ottawa, our hospitals have surge capacity plans to increase ICU capacity. I know they're ready. I know they've been thinking about this. The challenge is that they are often over 100% capacity already, and they're trying to catch up on procedures, surgeries, investigations that have been delayed that are important for cardiac issues, for cancer. These are things they don't want to stop, but they will have to if there's too much COVID and they need to treat people who have COVID. So what we expect, and I think this is also where the science table underlined, it comes later. The hospitalizations grow after a couple of weeks. And so we're not seeing it right now, but we have to be ready and we have to turn the curve, flatten the curve, like blunt the growth, I believe was the term that Dr. Brown used, because it will go too high.
Okay, thank you. Next up, we have Ottawa Sun, Jackie Miller. Jackie, over to you.
Thank you. The province is setting up pop-up rapid test giveaways for the holiday. Do you have any idea when we'll be getting any pop-ups in Ottawa? And each person gets one test. I'm wondering if you can advise people what you think they should do with the one test they get, one free test.
Thank you. I think that's something we should probably prepare, that kind of messaging on our website and our social media and other communications channels. It's a good question in terms of how to use just one test if you had one test. What we know is that the province has chosen 10 sites in Ottawa for the distribution of rapid antigen tests, and we think the first shipment will come on December 21st. So that means in about 5 days, we should be able to, at 10 sites in Ottawa, make rapid antigen tests available to people. And how to use them. First of all, if you have symptoms of illness, may as well go straight to a PCR test to make sure that's not COVID, because the PCR test will really confirm that for you straight off. And if you don't have symptoms, then what you would like to know, is probably if you're going into a setting where you're concerned about others that are more vulnerable to infection, and that result would change your actions in terms of whether you would participate or not. That would be a good use case. Knowing that if it's negative, you still need to think about how are other ways to reduce the risk, because there are more vulnerable people there. But it's a tool that could be added in.
Thank you. And I wanted to follow up on Liz's earlier question about the science table projections. I mean, the science table has said that Ontario needs to immediately reduce contacts by 50%. Quote, waiting for more information will eliminate the opportunity for action. Dr. Uni, a couple hours ago, called it an emergency situation and said action is needed in hours, not days. You've said that you can issue a letter of instruction. Can you give us some idea of when you might be taking action?
Yes, so the process requires that we discuss this with the Office of the Chief Medical Officer of Health. So those discussions are happening today. And, we know if we're looking at capacity limits in a variety of settings that affects businesses. So we've been seeking to get input from businesses. We know that businesses need some notice to be able to implement measures. So, we'd like to give them at least a couple of days notice before things could be in place. This is really, really tough. This is not what we wanted for businesses at this time of year. So we need to move quickly, but we also know the province is still having conversations, and that this is a province-wide challenge. So it is also possible, that we'll see more action there.
Thank you.
Okay, thank you. Last question, dernière question à Radio-Canada, Frédéric Pépin. Frédéric, c'est à vous.
Oui, merci Maxime. On va commencer avec vous, Dr. Etches. Alors, Dr. Etches, ça a déjà été mentionné par le bureau Dr. Roumeliotis, comme quoi que, pourquoi pas est-ce que ce serait les bureaux de santé qui émettraient des restrictions de façon pour leur région. Vous, à Ottawa, est-ce que vous envisagez d'émettre des restrictions du nombre dans les rassemblements ou même des gens qui peuvent aller, le nombre de personnes qui peuvent aller dans les restaurants, par exemple, pour la région d'Ottawa uniquement, au lieu d'attendre après la province?
Je pense que le point important au début, c'est que c'est pas assez de vacciner pour cette augmentation dans la COVID, avec le COVID dans notre communauté. C'est pourquoi nous avons l'avis pour toute la population de faire leur part, et avec les autres vagues dans notre communauté, il y a un point où c'est important d'utiliser le règlement, de changer les normes des contacts étroits. Et c'est une discussion aujourd'hui avec la province de considérer comment on peut réduire les contacts étroits avec les instructions pour les business et différents sites à Ottawa. Et c'est aussi une discussion à la province, niveau provincial. Alors, on n'attend pas, on prépare et on a une reconnaissance que la province peut aussi faire quelque chose quand c'est difficulté avec toute la population d'Ontario.
Si je peux juste avoir une précision là-dessus, Dr. Etches, vous dites simplement que vous attendez de voir, c'est ça ce que la province va faire, là. C'est ça?
Mais on attend, on n'est pas, c'est pas que j'attends, c'est que je prépare de faire les actions locales si la province ne fait pas quelque chose.
Merci, Dr. Etches. Si je peux me permettre ma deuxième question maintenant pour le maire Watson. Monsieur Watson, je ne sais pas quel genre de message vous voulez envoyer à la population et les francophones qui vont nous écouter ce soir quand on va parler de ceci. Mais vous, Monsieur Watson, qu'est-ce que vous allez faire pendant Noël, pendant le jour de l'an? Vos rassemblements, ça a l'air à quoi? Puis quel message vous envoyez à la population en même temps?
Oui, mais mon plan pour Noël est de visiter ma nièce à New York. Mais hier, j'ai annulé cette vol et la réservation à l'hôtel et je vais rester ici à Ottawa. Et mon message est vraiment clair. C'est le même message de Dr. Etches et tous les médecins dans notre pays. Ce n'est pas l'année d'avoir une grande célébration avec 20-25 personnes chez toi. C'est trop dangereux de faire ça. Et ça, c'est une situation très, très sérieuse. Et il faut que la population suive les règlements de santé publique parce que nous sommes dans une bataille très sérieuse. Et c'est le temps de faire des sacrifices, annuler peut-être les voyages, si ça c'est possible, parce qu'on ne sait pas l'avenir avec cette nouveau variant de COVID-19. Est-ce qu'on va trouver un autre variant dans quelques jours? Il y a beaucoup de questions et pas beaucoup de réponses. Alors, votre sécurité, la sécurité de votre famille est importante, mais en même temps, c'est nécessaire de limiter les contacts avec des grands groupes pour protéger toi et vos amis et vos familles. Merci. If I could just mention one other item on the rapid testing kits. I noticed Toronto and the GTA have the kits. We'll be working with the province to see if we can't get those kits sooner than the 21st of December. That's 5 days from now. And I know that just watching some of the news coverage today, people were lining up getting those kits. And I think Ottawa residents should have the same ability to get those kits sooner than later. So we'll raise that with the province to make sure that we have the kits and we have the distribution system ready to go when we do receive them, hopefully before the 21st. Thank you.
En français, s'il vous plaît, là-dessus, M. Watson, c'est important.
Oui, certainement. Je suis un peu déçu que le GTA et les résidents de Toronto avaient accès pour les comment on dit en français, le rapid test, les examens rapides pour COVID-19. Et on va pousser le gouvernement provincial de fournir des kits ici à Ottawa avant le 21 décembre. C'est vraiment important pour nos résidents d'avoir accès à ces examens aussi. Merci.
Merci.
Merci beaucoup. Thank you. So there we had, folks, lots of valuable information shared here today. We appreciate your help in getting this information out there. Keep on keeping on. Beaucoup d'infos aujourd'hui. Merci beaucoup aux médias de votre soutien et c'est grâce à vous que l'on peut diffuser cette information. C'est tout le temps qu'on a aujourd'hui. That's all the time we have today. Thank you and see you next time.